have a look at basic mobilization and soft tissue technique for the lumbar region. So often we have tight muscles here, we have low back pain, and combining the treatment with movements and postural advices, ergonomic advices, when we combine this mobilization massage technique, we have a good setup of treatment. Let's have a look to the muscle. We have the long extensor muscles. We have muscles from the pelvis going up to the rib here. We have the pelvis muscle which come from this side, and we have even the abdominal muscle came here, and the quadratus lumborum on both sides. So there is a lot of muscle here, and a very simple technique to loosen is just this shaking technique. You just let's swing the pelvis. If you can see your patient has a strong lordosis, it's not the case in this gentleman, so you can put a pillow under the belly. If it is like this, it's okay. You just shake, you shake, you shake, you shake. Then we have this stretching technique from the middle of the spine. With the two thumbs, I stretch away from the spine, the muscles, and I hold it here. It's a soft, gentle stretching technique which is reducing the tension along the spine. The same I can do with the palmar technique, just going like this. I'm using my body weight, the direction of the pull is like this. Helpful massage technique is this one too, with both palms. Massaging along the pelvic crest. And as well the skin rolling technique. I just take a bit of the skin and I roll it outside. This is a soft tissue technique, a connective tissue mobilization. Now when we have relaxed the muscles around, we can start with mobilization technique. A very simple one. I put my hand, the whole hand here on the lumbar region, and gently I'm pushing towards the abdomen. This is posterior anterior movement. Doing like this, I can feel as well how springy, how soft the lumbar spine is. If the lumbar spine is really soft, there is no need to do this mobilization, but if it is a bit rigid, we do this mobilization gently without forcing. There should be no real pain down the legs or so doing like this. If the patient says, oh, I have a pain down the leg, stop it. It's okay if I had a local pain. And we can come up a little bit. We can use the fingers as well and going on the stiff part and mobilizing like this. Let's say you have a rigid part, it's a rigid, stiff spine. You can mobilize each vertebra in this posterior anterior way with both thumbs, or like this. If we have a situation of great pain, we do that very gently. It's just tiny movement. Another technique is I come here, these are the spinous processes, and I just catch them by the side with that part of my hand, and I shake in this direction. The same I can do more specific on each of the spinous processes, doing like this. The direction of my push is along my fingers. Okay, a simple way to mobilize is as well to give these vibrations. Put my whole hand on the spine and I vibrate. I ending the mobilization treatment with some massage and to work again on the soft tissue.